Rashid. I'm with Jim Addiego with Dream Systems. He's here to speak with us about snoring and sleep apnea devices. It's pretty big now in our culture and time and age, and it's very important for us dentists to understand how to treat, at least to recognize symptoms, if not also treat. And so Jim is here to speak with us.
I'll be there to answer questions about snoring and sleep apnea, different oral appliances that are available, taking bites and impressions, the importance of diagnosis, working with physicians, getting a sleep study, things like that.
Right.
So, I brought several different appliances that we make. I am a snorer. I do have severe sleep apnea. I've been tested at the California Sleep Solutions sleep facility twice. I've taken many home sleep testing, so I'm very involved in sleep. I like to try the appliances that we make and some of the over-the-counter ones that you buy on the internet. So there's a lot of devices out there. We manufacture custom FDA 510K cleared medical devices, and we're also a Medicare approved lab for the sleep Herbst, and we also fabricate the Ema appliance. So anyway, I brought several of them. Some very basic appliances. This is called the Ema Device, developed by Dr. Joseph France. It's a repositioning appliance that brings the jaw forward. It's adjusted with little straps. They're interchangeable, so they come in shorter sizes. So as you're wanting to bring the mandible forward, you use these shorter straps. They also come in different flexibilities. These are more flexible than the blue ones. Okay, that's a very simple Ema device. We also fabricate the Herbst appliance. This is a Medicare approved appliance. It is originally an orthodontic appliance, but it has been approved for sleep apnea by Medicare, and we are been approved by Medicare to fabricate this device for Medicare patients. Okay, and it's adjusted. It's a hinge design. You have movement side to side. You have a little key here that you adjust, and that will bring the mandible slowly forward in little increments. Okay. And we have a new device that we're introducing called the Oasis Tma 10. It's also on the design of a Herbst appliance. It is FDA cleared, but it's not approved by Medicare yet, but we're in the process right now of getting that Medicare approved. It has little smaller hinges. It also moves side to side. This can be adjusted intraorally by turning these little, there's little screw holes here, and by turning these 2 turns all the way around, you're able to adjust 1 millimeter forward. Okay. And we also do the Oasis. We're the research and development lab for the Oasis oral nasal airway system, developed by Dr. Mark Abramson from Redwood City, California. This is a unique device. These devices all are mandibular repositioners, but the Oasis not only is adjustable, advancing the mandible, bringing the mandible forward with this hinge here, or with this shield here. It also has nasal dilators, which help open up the nasal passages. And we can also add lingual tongue buttons that lift the tongue up and forward. So it's very unique in the features of mandibular repositioning, nasal dilation, and also tongue positioning. Sometimes the patient will wear an oral appliance, and the physician will find that even though it's working, the AHI, or the apnea-hypopnea index, has not been reduced adequately. So they'll do a combination therapy. So we can actually make a combination appliance, add this little bracket to, this is a Herbst appliance. So we add this custom bracket that we make, so you can wear the appliance with your CPAP. And it's nice because we've designed it so that you can take this off, so then the person, if they go on a trip, they could just wear the device. Okay, or they can attach it when they get home. And then they can wear it with their CPAP again. Okay, and one other thing that we've been recommending over the years, as thousands and thousands of these have been made, the bite changes sometimes over time. So it's important that a morning repositioning appliance be used for trying to deprogram the bite to help the patient get back to a normal bite position. So anyway, it's a fascinating field. I told you I do have snoring and I do have sleep apnea. So it's important I continue learning from dentists, from physicians, sleep centers. So I'm excited to be a part of this field.
So Jim, why do you make Sacramento smile?
We make Sacramento smile because we save marriages by helping wives deal with their husbands snoring or husbands dealing with their wives snoring. We help people with their medical conditions, with sleep apnea, which is associated with many other health conditions like hypertension, high blood pressure, cancer, strokes. All those things are accentuated by sleep apnea. So we're out there applying, educating dentists and patients of how to get a better night's sleep, either whether they're using their CPAP or using an oral appliance.